The North Carolina Hospital Association, in conjunction with North Carolina State University and the Governor's Office, decided to recognize those healthcare institutions that are really working, much like everyone else in this room, on excellence. And the North Carolina Award for Excellence, facilitated by the North Carolina State University Industrial Extension Service, is aimed at improving the performance of organizations across North Carolina. Modeled after the National Malcolm Baldrige Quality Award, organizations must receive the state's Baldrige Program Level 4 Award for performance excellence before becoming eligible to apply for the national program. Performance excellence refers to an integrated approach to organizational performance management that results in the delivery of ever-improving value to customers and stakeholders, contribution to organizational sustainability, marketplace success, improvement of overall organizational effectiveness and capabilities, and organizational and personal learning. So we're excited today to be honoring two organizations within the Hospital Association in regards to these particular awards. And I'll be asking representatives from Care Partners Health Services. I'm asking Tracy Buchanan, the President and CEO, to come up to accept this award. And I'll also be asking William Burton, on behalf of Kenneth Sowers, who's not with us today, to come up and receive the award on behalf of Duke University Hospital. So Tracy and William, please make your way to the podium. Duke University Hospital.
Let me tell you, what you see in these two award winners of the Governor's Award is the best of North Carolina. And now more than ever, we have to look for better ways to do things, more efficient ways to do things, and also improve the quality of the way we do things. Because we are all facing tough economic times, and I know in looking at my budget for next year, there is no new money that's all of a sudden going to drop out of the tree and save the day. So we, like families across America, are going to have to do with what we have and do it better and more effectively. And the most serious challenge that we have in this state and this nation is with regard to health care. And it's the most complex issue that I'm having to deal with in my first 5 weeks as governor of this great state. And believe me, it is complex. There are so many different interchangeable parts and parties and organizations that are involved at this point in time. And one message that I'm conveying to many of you out in this audience that I can convey to many of the hospitals is this: now more than ever, we have to be a team. We can no longer afford to have these individual silos within our healthcare system, all trying to figure out how do we just stand up for the next year and then figure out the 5-year or 10-year plan later on. The fact of the matter is our current healthcare model is not sustainable. We've got to change it. We've got to reform it. And that's my first major issue that I'm having to deal with as governor right now, is fixing, frankly, a very broken system in the state of North Carolina with regards to our Department of Health and Human Services. It is probably consuming at least 25% of my time as governor during my first 6 weeks. This is not what I anticipated, but I volunteered for this job, and I'm not going to run away from it. I'm not going to play the victim card. And I've got a Secretary of Health and Human Services. Her name is Aldona Voss. She is literally working 16 hours a day right now. Every time I call her at 10 o'clock at night, she's still at Dick's Hospital in her office there, doing her job. And by the way, she's working for $1 a year. She's doing it for free. She's been living at the Sheraton Hotel in downtown Raleigh. She just got kicked out of the Sheraton, by the way, because of a conference coming in. She's She's been there 5 weeks and they just kicked her out. She's in the Marriott tonight. It's tough to be a leader these days. I told her the Sheraton, the Marriott's frankly a better hotel. I'm going to say that for the record, especially because I kicked her out. But the fact of the matter is, let me tell you what we're attempting to do. And I've explained this to many of the people in the medical community. There have been two massive decisions that we've been given 5 weeks to make decisions on in the short term. And during that short 5 weeks, I've had to analyze the cost, the operations, the capital, the partnership, the sustainability. If we make this decision, what is the impact now and what is the impact in the future? And if we make this decision, what is the impact now and in the future? And the sad news is, after looking at both evaluations, there was no great answer. Each answer had its positive and the negatives. This is especially referring to Medicaid exchange and whether to have or Medicaid expansion, and also whether to go have a state exchange or a federal exchange. Let me tell you what the major issue for me right now is in the short term, and I'm not closing the door down on long-term issues with regard to this. The issue right now is our system that we have in North Carolina government is so broken, even if we wanted to do Medicaid exchange, we do not have the systems right now to deliver it, especially referring to information systems. In fact, I'm going to be very blunt with you. Right now, I'm concerned in the information systems that we are inheriting right now, and some that have been developed in the last 2 years and are supposed to go online in the next 3 months. We are getting feedback from those inside saying that they might not be workable. These are tens of millions of dollars that have been spent on information system programs, which you are dependent upon. And by the way, food stamp recipients are also dependent upon some of those same recipients, and they might not work. So I've got these teams coming into Raleigh right now trying to assure me and assure the people that are dependent upon Medicaid, the existing Medicaid system, can be delivered within the next 3 months. This is how broken it is at this point in time. The other issue I'm dealing with is our administrative costs are far too high in North Carolina. Our administrative costs to provide Medicaid to our existing customers, this is before we even consider expanding it right now, is $6,000 per individual. The administrative cost. In Georgia, it's $4,000. That's a huge differential. I recommended in my State of the State speech 2 days ago to please unleash our hands and let us decrease some of these administrative costs so more of the actual services get to the people in need as opposed to the administrators and the overhead in delivering those costs. And we're talking about appeals processes that are costing literally millions of dollars each month as we stand here. And it's backed up by months at a time. Appeals process on who gets Medicaid and who doesn't get Medicaid, and who makes that final decision. The legal ramifications that we're having to go through right now are enormous, in addition to the information systems costs. So my first goal, hopefully within the next 3 to 4 months, is that we can guarantee that the existing system provide the existing Medicaid services to the people in need of North Carolina is fixed before we have any more consideration of expanding that system. So this is the tough decision that we've had to make. But we are working with you, and I've got commitments with the heads of your hospitals throughout the state of North Carolina to work together to figure out a way of better deliverables while retaining high-quality services. But if we do not do this as a team, between the hospitals, between your doctors, between the nurses, between all the different organizations that are responsible for this, and right now there's a lot of this going on as opposed to this going on, which long-term won't work for anybody. We're going to get you all at the same table, and we're going to all make the same tough decisions together. And that is my guarantee to you as governor. And I'm going to Washington on Friday. I'm going to be meeting with all the governors throughout the United States of America, and we're going to be going to the White House also. And frankly, we need better conversations between the governors and the federal government, because both have no idea about the details and the ramifications of this new massive legislation that people frankly don't know the short-term and long-term ramifications of. So we're all in this together. The governors are working together, and we're also working with the White House in this effort as we speak. We have to do it now, for the sake of those people in need of our health services, for the sake of the sustainability of our medical and healthcare services, and for the sake of our country, in which healthcare is such a paramount part of our quality of life. So I look forward to working with each of you. Again, it is these people that got this award today that are looking for, think of the Baldrige Award. I know it very well. I used to follow the Baldrige Award examination 25 years ago when I was with Duke Energy Company. If you can follow those Baldrige Awards, which are always talking about continuous improvement, we have no choice but to every single day, just like someone in a manufacturing plant is always having to look for continuous improvement, because if they don't, that manufacturing goes out of business. We have to think the same way within government administration, and you also have to think the same way within the healthcare community. Every day we go to work, we have to think of how can we deliver this service in a more effective and high quality way. If we don't do that, we will not succeed in providing the right service that's affordable and needed for so many at this point in time. Thank you so much. Thank you to the Governor Awards winners. It's an honor to be here, and I look forward to being at the table with you as we come up with not short-term fixes, but long-term sustainable solutions. Thank you, and God bless each one.